I'm Dr. Sian Oram, and I'm a lecturer in women's mental health at the Institute of Psychiatry, Psychology and Neuroscience at King's College London. My work involves research into health service responses to different types of violence, including human trafficking, and this video abstract accompanies our recent study investigating NHS professionals' contact with victims of human trafficking, which is published in BMJ Open. Human trafficking is the recruitment and movement of people by means such as threat, coercion and deception for the purposes of exploitation. It's a crime and it's a violation of human rights that's thought to affect every country in the world, with one estimate putting the number of people worldwide affected at 2.5 million. Many victims of trafficking experience physical and sexual violence, psychological abuse, and poor living and working conditions, and studies show that many suffer from poor physical, mental, and sexual health after escaping from their abusers. Healthcare professionals might therefore have an important role to play in efforts to address human trafficking by providing clinical care, by providing information about support options, or making referrals for further support. But do healthcare professionals come into contact with victims of trafficking, and do they know what to do when they suspect a patient has been trafficked? To answer these questions, we conducted a survey of NHS staff attending mandatory face-to-face training on child protection of safeguarding vulnerable adults at 10 NHS sites and at meetings of the Royal College of Emergency Medicine. Staff were asked to complete a questionnaire that asked about prior training and contact with potential victims of trafficking, and perceived and actual knowledge about human trafficking and confidence to respond. Almost 800 NHS staff participated across the sites, including staff working in emergency medicine, in maternity services, in mental health, and paediatrics. So what did we find? 1 in 8 participants reported previous contact with a patient they knew or suspected of having been trafficked, and among maternity professionals, this figure rose to 1 in 5. However, the majority of participants reported that they lacked confidence in how to respond to a suspected case of human trafficking. 87% responded to say that they lacked knowledge about what questions to ask to identify potential victims, and 78% reported that they'd received insufficient training on how to assist trafficked people. We found good levels of knowledge regarding the definition of human trafficking and the health problems that are commonly experienced by victims of trafficking, but 95% of participants were not aware of the scale of human trafficking in the UK, and 3/4 were not aware that calling the police without appropriate safeguards could put a patient in more danger. Less than 10% had previously received training on human trafficking, but more than 3/4 reported that they'd like to receive information and training on human trafficking in the future. Levels of interest were particularly high among staff working in emergency medicine and mental health. It's important to think about the study's strengths and limitations when interpreting these findings. The study was conducted in multiple sites across England, in London, Birmingham, Cambridge, Manchester and Kent, and we included professionals working across a range of different clinical disciplines and a range of grades. And our analyses found that the questionnaire we used to survey NHS staff was robust. But because our survey was conducted only with hospital staff, it isn't possible to say whether our findings are generalisable to GPs and to other staff working in primary care. We also can't be sure that our findings are typical across England because study sites were located in areas where the police had identified 5 or more victims of trafficking in the previous year. But what does the study tell us? NHS staff working in secondary care are in contact with potential victims of human trafficking, but they lack confidence about how to respond appropriately. They have the opportunity to play a critical role in efforts to tackle human trafficking and in helping to improve the well-being and safety of this vulnerable group. Training is needed, particularly for staff working in maternity services, but also for staff working in mental health, in emergency medicine and paediatrics. And training should focus on how to identify and respond to victims' needs, including through making safe referrals for further support.